This is Eyewitness News with live breaking news.
We're looking at live pictures here at pretty ominous as it burns right toward that road there. We have Denise Dedore. Let's see if we can keep this heavy smoke and its effect on people here in all parts of Southern California. Denise?
Definitely a lot of soot and ash raining down here. I'm here live with Dr. Matthew Mullarky with St. Joseph Hospital of Orange County. I see a lot of people coming into the emergency room right now, a lot of them looking pretty bothered.
Yes, on a day like this, folks that have asthma, COPD, emphysema are going to have a lot of respiratory issues. Try to encourage people to stay out of the outdoors, try to stay indoors. If you have air conditioning capabilities, use your air conditioning because it's going to filter the air, trying to help prevent respiratory problems.
You know, I just want to point out that I'm wearing a mask because I've been standing out here for quite some time, and you're just coming in and out. So, but do you recommend people wear a mask? If
you're going to have to be outside, wearing a mask to help prevent the exposure to the soot, the ash, and the poor air quality would be a good idea, particularly if you're going to be outside for more than about 30 minutes.
The stuff that's coming down, it's pretty thick. Should we worry about that getting in our lungs, or is it the small particulate matter we're concerned about?
It's more small particulate matter. We also have to be concerned about eye injuries, particularly if there's any embers. We're a little bit further away from the fire here, so it's going to be more ash than embers.
And the people who are coming in, are they complaining about this?
So far, so good. We really have not had any respiratory emergencies since I've been on duty for the past 3.5, 4 hours. So, knock on wood, we're doing well.
And then I've been hearing reports about some staff going home because they're concerned about their homes. Many people here live in the affected areas. What's going on here with the staff?
So far, here at St. Joe's, we've not had to have anybody go home. Nobody has been affected as of yet. We're fully staffed and prepared for all the emergencies.
Any other advice for people who are driving through this area, coming in, seeing all the smoke? You were one of those.
Yeah, if you have to get home, you got to be very careful and allow a lot more time, because there's going to be a lot more traffic because of traffic being built up because of this particular emergency. One
of your colleagues, Dr. Kashiri, said he might go home, check on his home. He doesn't live too far from here because we're 6 miles away from the fire.
Right.
I hear the traffic is really bad. It's hard to get out anywhere around here.
You know, considering the traffic that bad, if you don't have to be out and you don't have to be going in that direction, you're probably better off staying home because you don't want to get caught sitting in traffic with this air quality as well.
And the usual advice, keeping the windows closed, making sure the filter is running. If you have a swamp cooler, that doesn't have a filter.
Yeah, I don't know, there's a lot of swamp coolers here in Southern California, but the main thing is staying indoors, windows up, air conditioning on. Any sort of filtration system would be of benefit.
And I understand many schools are closed. I mean, this is not a day to be going to soccer practice or baseball or anything like that.
Yeah, physical activities would not be advised today. Anything that's going to require you to be out, run and do aerobic type exercises, because you're going to get compromised from a respiratory status.
And I know you're very calm about this, but I've always read reports that in weather like this, in conditions like this, it increases the risk for stroke, for asthma attacks.
Well, certainly for asthma attacks, because it's a primary respiratory problem. I think the other things are more about the stress related to all the other things that are going on around people.
Are people more stressed inside because of this?
Again, we've been very fortunate so far. We have not seen that. That's not been a complaint that we've run across as of yet today.
But a lot of the patients looking pretty bothered to me right now.
Absolutely. Everybody's bothered by everything, particularly those folks who have property in the area where the fire is taking place.
Speaking of property, many homes have gone up. I know we're worried about the brush fires and things from organic things, but what about the toxins from homes that are burning?
Again, in those situations, some people feel compelled to stay at their home, try to use hoses to hose down their roofs and their surrounding property. Let the professionals take care of it. Try to get yourself out of those areas to prevent further injury and exposures.
All right, Dr. Mullarky, thank you so much for all that advice. Thanks for keeping an eye on the situation, and we'll be monitoring the smoke and everything else as things go on this afternoon. Live in Orange, Denise Dedore, ABC 7 Eyewitness News.
Denise, thank you. I'm really glad that you're wearing a mask. We're going to check back with Greg Lee.